How to spot and manage IBS, Irritable Bowel Syndrome, versus other gut disorders. Irritable Bowel Syndrome, or IBS, is a condition that impacts millions of people worldwide. Yet, it is often misunderstood and misdiagnosed. If you've experienced frequent digestive discomfort, like bloating, cramping, diarrhea, or constipation, you may wonder if IBS is to blame. However, other gut disorders, such as inflammatory bowel disease (IBD) and celiac disease, can mimic the symptoms of IBS, making it vital to understand the differences. In this video, we'll walk you through how to recognize and manage IBS effectively. We'll cover its symptoms, distinguish it from other gut-related disorders, and provide accessible strategies for relief, including the low FODMAP diet, stress management, and knowing when to see a GI specialist. Let's empower you with the knowledge to take control of your gut health. IBS is one of the most common functional gastrointestinal disorders. Unlike structural problems, functional disorders impact how the gut works rather than its physical structure. People with IBS often experience chronic abdominal pain, bloating, and changes in bowel habits such as diarrhea, constipation, or both. These symptoms can significantly impact daily life, from reducing work productivity to interfering with social activities. However, IBS shares symptoms with other conditions, such as inflammatory bowel disease, IBD, celiac disease, and food intolerances. IBD, for example, includes Crohn's disease and ulcerative colitis, which are inflammatory conditions that can cause severe gastrointestinal damage. Celiac disease, on the other hand, is an autoimmune disorder triggered by consuming gluten. Both IBD and celiac disease can cause abdominal pain, but other telltale signs like bloody stools, weight loss, or malnutrition separate them from IBS. That's why understanding what IBS is and isn't is crucial for managing your symptoms effectively. So, how do you know if you may have IBS? First, look for patterns. IBS symptoms are ongoing and tend to follow a predictable cycle. For example, you may notice that stress, specific foods, or hormonal changes trigger your discomfort. Symptoms typically include abdominal pain or cramping, often relieved after a bowel movement, bloating or feeling uncomfortably full, alternating diarrhea and constipation, a sense of incomplete bowel movements. Unlike more serious conditions, IBS doesn't normally involve red flag symptoms like blood in the stool, significant weight loss, or persistent fever. However, frequent digestive discomfort should still not be ignored. If you suspect IBS, keeping a symptom journal can help. Write down what you eat, your stress levels, and any digestive issues you experience. This journal can be a valuable tool when discussing your symptoms with your healthcare provider. Many people with IBS find relief by adjusting their diet, and the low FODMAP diet is one of the most effective options. FODMAPs are fermentable carbohydrates that are poorly absorbed in the gut, leading to gas, bloating, and discomfort. Foods high in FODMAPs include onions, garlic, wheat, certain dairy products, and some fruits like apples and cherries. The low FODMAP diet starts by temporarily eliminating high FODMAP foods from your meals. Once you notice an improvement in symptoms, you slowly reintroduce these foods one by one to determine which specific ones trigger your IBS. For example, if onions consistently cause discomfort, you can avoid them while enjoying low FODMAP alternatives like scallion greens or chives. This step-by-step approach ensures that you're not unnecessarily restricting your diet and still getting all the nutrients you need. Remember, the low FODMAP diet can be complex, so working with a dietitian is recommended. They can guide you through the process and help tailor the diet to your unique needs. Did you know that your gut and brain are closely connected? This is known as the gut-brain axis, and it explains why stress often worsens IBS symptoms. When you're stressed, your body releases hormones that can disrupt normal digestive function, leading to cramping, diarrhea, or constipation. Managing stress is therefore a vital part of managing IBS. There are several ways to reduce stress and improve your gut health. Mindfulness and meditation. These practices train your brain to respond more calmly to stress. Even 5 minutes of focused breathing or mindfulness exercises can make a difference. Yoga or gentle exercise. Physical activity helps reduce your body's stress hormones while promoting gut motility. However, avoid strenuous exercise that might worsen symptoms. Journaling or talking to someone. Expressing your feelings can reduce stress levels and help you gain perspective on triggers that may be affecting your symptoms. Stress management isn't a one-size-fits-all solution. Experiment with different techniques to find what works best for you. While dietary and lifestyle changes can be highly effective, some people benefit from medication to manage their IBS. It's important to understand that no single medication works for everyone, as IBS symptoms vary between individuals. Common categories of IBS medications include antispasmodics to reduce abdominal pain and cramping, anti-diarrheal medications for those who experience frequent diarrhea, laxatives or fiber supplements for constipation-predominant IBS, probiotics, which may help balance gut bacteria in some individuals. Talk to your healthcare provider to determine which option is best for you, depending on your symptoms and medical history. Medications are generally used as part of a larger management plan and not as the sole treatment. While IBS is not life-threatening, persistent or severe symptoms should not be ignored. In some cases, what appears to be IBS might actually be a sign of a more serious condition requiring medical attention. It's important to see a gastroenterologist, GI specialist, if you notice any of the following warning signs. Unexplained weight loss, blood in your stool or black, tarry stools, persistent or severe abdominal pain that doesn't improve after bowel movements, symptoms interfering significantly with your daily life despite treatment. A GI specialist can perform additional diagnostic tests such as colonoscopies, stool tests, or blood tests to rule out conditions like inflammatory bowel disease or celiac disease. Early diagnosis and intervention can make a big difference in managing your gut health. Living with IBS doesn't have to be overwhelming. Incorporating small, achievable habits into your routine can help minimize symptoms and improve your quality of life. Here are some practical tips to make managing IBS easier. Keep a symptom diary. Track food, stress levels, and symptoms to identify patterns. Stay hydrated. Drinking plenty of water helps regulate digestion and prevent constipation. Eat smaller, frequent meals. Large meals can overwhelm the gut, so smaller portions are gentler on your digestive system. Limit triggering substances. Caffeine, alcohol, and fatty or spicy foods can irritate the gut. Prioritize sleep. Poor sleep can worsen IBS symptoms. Maintain a consistent sleep schedule and practice good sleep hygiene. These lifestyle changes complement dietary adjustments and stress management techniques for a holistic approach to managing IBS. Managing IBS is a journey, and it's essential to set realistic expectations. Some days may be better than others, but understanding your body's unique needs is the key to finding relief. Stay informed, be patient with yourself, and seek support when needed. Remember, there's no one-size-fits-all solution to IBS, and your management plan may evolve over time. Work closely with healthcare providers, such as dietitians and GI specialists, who understand the nuances of IBS and can create a personalized strategy just for you. Equally important is building a support system of family or friends who can encourage you when challenges arise. Irritable bowel syndrome can be a confusing and frustrating condition, but with the right knowledge and tools, it can be managed effectively. By identifying triggers, following a low FODMAP diet, reducing stress, and seeking help when necessary, you can significantly improve your quality of life. Remember to trust your own journey. While IBS management may seem daunting, small, consistent efforts lead to meaningful progress. Stay proactive, stay informed, and remember, you are not alone in this journey to better gut health. Your first step toward relief starts today. Take control, take action, and take care of your gut.